Hey, my name is Haley Sumner, and I'm a nurse practitioner student at Auburn University. Today we're going to be doing a complete head-to-toe assessment. I'm going to show you guys the surroundings, just so you guys see what all is in the room with us. That's my patient, Matthew. We're in an old hospital room. Okay, I'll put my computer back up to charge. Alright, and then we're going to go ahead and get started. And make sure this is in the right field because I don't want our heads to be cut off. Go back a little bit with it. I'm sorry, I don't have anybody to help me video this. Alright. Screen. Okay. So when I walk in to do this assessment, there would have already been a full set of vital signs taken in triage, and I would have reviewed those to find that all of his vital signs are within normal limits. And then throughout this exam, we're going to maintain patient confidentiality, we're going to maintain patient privacy. And for the purposes of this exam, I'm going to do everything unilaterally on his left side, but in a real exam, I would do that bilaterally, obviously, to assess every system. And throughout each system, I'm also going to be assessing the skin in every area. His height, he is 6'4", and his weight was approximately 225. So his BMI, I think, was like 27.4 or 5, and that put him in the overweight category, although he's a very muscular, fit guy, and so that's a little bit skewed because muscle mass weighs more than fat, and so he is very fit and in good shape. I'm going to give you 3 words now, and then we're going to revisit them at the end of the exam, okay? So I need you to remember apple, Mickey Mouse, and tree, okay? So just a general survey of the patient. When I walk in the room, he appears to be healthy. He's alert. He's sitting up. He's smiling. He's slightly slouched posture, but nothing terrible. But he appears to be generally healthy and pleasant. He did walk into the exam room, and so his gait was steady and normal. His speech I'll be assessing throughout the exam to make sure that it's coherent and clear. There's no signs of distress or anything noted. Can you tell me your name?
Matthew Nichols.
And can you tell me what day of the week it is?
Tuesday.
And where are you at?
Calhoun Liberty Hospital.
And can you tell me who the president is?
Joe Biden.
Okay, so he is alert and reading ×4 as well. And his skin appears to be normal. There's no flushing, no bruising, no obvious lesions or any abnormalities. His height and weight, obviously, I said he was very tall and thin in stature. I already said his BMI placed him a little bit overweight, although he's not. He's very fit and muscular in shape. It appears to be normal development, no sexual development abnormalities upon assessment. His posture, he's upright, nothing abnormal there. His motor activity, like I said, he walked in normal, so that was fine. His dress, he's dressed appropriately for the weather. He's groomed appropriately, no odors or anything like that noted. His skin, again, is pink. It's normal. I don't see any obvious lesions or abnormalities. It's warm. It's dry. And then his nails, I'll assess those as well. His cap refill is normal. And there's no clubbing. There's no cyanosis. And they are they're hard and smooth. There's no ridges noted to his nails, no bruises or anything to his skin. So skin and nails are good. And then we're going to move to HEENT. So we're going to look at the head first and his hair. His hair is blonde. It's thick. There's a normal distribution. I don't see any balding, any thinning. I don't see any obvious infestations. And on his scalp, I don't see any flaking or scaling. And then feel his actual skull. It feels normocephalic and symmetrical. I don't feel any lumps or any depressions, any step-offs, any crepitus or anything like that noted. Looking at the face, everything looks to be normal. There's no obvious drooping of the eyes or lips noted. Can you lift your eyebrows for me? Squint your eyes really tight. Okay, now open your eyes. Okay, good. Smile really big, frown, puff out your cheeks. Okay, so cranial nerve 7, the facial nerve is intact. And then we're going to check for sinuses, your frontal sinuses here and your maxillary capillary sinuses. Any tenderness with those?
No.
Okay. And then I would transilluminate this also with a pen light. I'm going to do this bilaterally. And those were the normal limits. There was no tenderness or anything with the sinuses. And then we're going to go to TMJ. Open your mouth for me. Close down. Okay, that alignment was normal. I didn't hear any clicking noises. There was no tenderness with that. And it aligned appropriately when he closed his mouth. Clench your jaws for me. Okay, and I feel the masseter muscles, so cranial nerve 5, which is the trigeminal nerve, is intact. We're also going to do some sensation tests to your face. This is going to be dull, and this is going to be sharp. Okay, so close your eyes for me. Tell me if you feel sharp or dull.
Sharp, dull, sharp, dull.
Okay, so that is within normal limits as well to sensation. I would do that bilaterally, and that's again just testing the trigeminal nerve, cranial nerve 5. Lymph nodes, I'm going to feel those. There's preauricular, postauricular, posterior cervical chain, occipital, anterior cervical chain, parotid, tonsillar, submandibular, submental, and supraclavicular. And those are all within normal limits. I don't feel the supraclavicular lymph nodes. These up here are barely noted, but they're soft, they're movable, they're not tender or any significant swelling noted. Moving on to the eyes, just a general first glance at the eyes, they appear to be normal, symmetrical. The pupils are both round and equal. I don't see any obvious swelling of the eyelids or any drainage from the eyes. The cornea appears to be intact. The sclera is white. His irises are green. And his conjunctiva looks pretty normal. They're pink and moist. There's no cyanosis or jaundice noted there as well. You feel any pain with this?
No.
No pain with the lacrimal duct gland either. Those are not tender or any swelling or anything like that. Then we're going to test the optic nerve, cranial nerve 2. And we would do that by a Snellen chart. We would check visual acuity. We would have him stand 20 feet away from the chart and cover one eye. And he does not wear corrective lenses, so he would do this exam without any corrective lenses. He would cover one eye and read down the lowest line of the letters before he can no longer read the next one, and that would be his visual acuity. We did his at the beginning of the exam, and it was 20/20 bilaterally. And then also the corneal light reflex, I would shine a pen light to the eye, and we would want to see that reflection just medially to the nasal aspect of the nose, and I do. That's visible and that's normal. So that's for the optic nerve. And then to test cranial nerve 3, 4, and 6, which is oculomotor, trochlear, and adducens, we're going to do points of gaze. And so I'm going to have you just follow my pen line. Okay, we're going to check for conjugate movement. And those are all normal. He's got good conjugate movement, no deviations at the eyes. And then we're going to do a cover test. So I'm going to stand in front of you and try to stand where we can kind of still see him. Cover your right eye. I'm going to cover my left. Sorry. Tell me when you see my wiggle. I'm going to wiggle my finger. Tell me when you see it come into your visual field.
Wow.
Good. And I would do that bilaterally. And that's also testing for cranial nerve 3, 4, and 6. And then cranial nerve 3, I would also look for, we would do pupillary responses with the pen light. Look at my finger. And good. Those are, his pupils are round, reactive to light and accommodation, so that's a normal finding as well for cranial nerve 3. And then confrontation test, we just did that. We did the confrontation test, and we did ophthalmoscope. I'm going to look with the ophthalmoscope. All right, so let's start this at 0, and I would dial up. I'm going to look at his left eye. I'm going to use my right eye. I'm going to look and visualize the red reflex and then focus in on the eye to see all of the different anatomical features of the eye. So just look straight ahead like you're doing. Okay, good. So I was able to visualize the optic disc, the red reflex, The optic disc was round, it was yellowish in color, and the borders were defined. The retinal background was normal also, and the vessels, there was no hemorrhages or narrowing of the vessels. And I also could see the macula and the fovea centralis. So those are all normal findings. Then we can move to the ears. Just upon just general assessment of the ears, I don't see any obvious foreign bodies or any deformities, any drainage, anything like that. Does that hurt at all?
No.
So no pain when I move the auricles. I'm going to stand right over here. I'm going to whisper something, and you tell me what you hear, okay?
1, 2, 3.
Okay, and I'm going to do that bilaterally as well. So then we're going to get the otoscope, and I'm going to visualize the inner ear. All right. Okay, I see just a little bit of honeycolor cerumen, which is pretty normal. And there's no foreign body, no redness, no swelling. I could see the tympanic membrane, it's pearly gray, and I could see the cone of light also at approximately 5 o'clock. And behind the tympanic membrane, I was able to see just a little bit of the incus and malleus bones of that anatomy structure of the inner ear. And then we're going to test cranial nerve 8, vestibulotrochlear, or vestibulocochlear or something. Nerve, cranial nerve 8. I'm going to do the Weber test first. I'm going to put it on top of your head, and I want you to tell me if you hear it the same on both sides, okay?
Yes.
Okay, so lateralization is normal, and that's tested with the Weber test. And then we're going to do the Rhine test, and this is checking for conduction. So I'm going to tell you, tell me when you stop hearing it.
No.
And when you stop hearing it.
No.
Okay, good. So that was a normal finding as well. Air conduction is longer than bone. And then we're going to move on to the nose. Upon visual assessment, I don't see any obvious drainage, no deformities. His septum appears to be midline. We're going to palpate. Any pain?
No.
Okay, you don't feel any crepitus or anything with the actual nasal bone. His cartilage is movable and non-tender. I'm going to look inside the nose. The turbinates appear to be pink and moist. There's no significant drainage, a little bit of clear drainage that's normal. No bleeding, no swelling, and no pain with palpation. So that's a normal finding as well. And then we're going to get you to smell a common object and tell me what you smell. Close your eyes. What do you smell?
Alcohol.
Okay, so that's testing for cranial nerve 1, which is the olfactory nerve, and that is within normal limits and intact. And then we're going to move on, ears, eyes, nose, throat. We're going to do the throat. First of all, lips and looking at the mouth. He's got normal looking lips. They're not cracked or peeling, no bleeding, no lesions or blisters noted, no ulcerations. We're going to look inside the mouth. Okay. Everything appears to be within normal limits in his mouth as well. His oral mucosa is pink, it's moist, there's no ulcerations, no blistering, no bleeding, no missing teeth. His dentation is normal. I didn't see any dental caries, I didn't see any abscesses. His gums are not inflamed, there's no bleeding from any of the gums. When he says his soft palate and uvula do rise, and so that's a normal finding. Also, his soft palate and hard palate are intact, so there's no cleft palate. His tongue is moist and pink. Raise your tongue up for me. Okay, and I'm able to visualize the sublingual ducts as well. And lift your tongue up, down, side to side for me. Okay, and that's testing for the hypoglossal nerve, which is cranial nerve 12, and that's within normal limits and intact as well, because he can deviate his tongue different directions. And then cranial nerve 9, also when he said his soft palate and uvula raised. So I think I already said that, but that is checking cranial nerve 9, the glossopharyngeal nerve. And then I would stimulate a gag reflex. I'm not going to do that today because I didn't warn him about that. He might get mad at me. But I would just take a tongue depressor or something and have him swallow, and then I would stimulate a gag reflex to ensure that his cranial nerve 10, the vagus nerve, is intact. His pharynx was within normal limits. There was no redness, no swelling. His tonsils were absent. He actually had a tonsillectomy, so I didn't see any tonsils. I didn't see any swelling or exudate noted or anything in the back of his throat. Neck, upon just visual assessment, everything looks okay with his neck. His trachea, look up a little bit. Trachea appears to be midline. It's movable. Does that hurt?
No.
It's non-tender. There's no lesions, no bruising, or anything of that nature to the skin on his neck. I would check carotid pulses, and they're +2 bilaterally. I would also check temporal pulses, and that's +2 bilaterally as well. Have your neck, I would do range of motion up and down, look side to side. All right, and then lean against my hand, against the side. Okay, and then shrug your shoulders against resistance. Okay, so that's checking for cranial nerve 11, which is the spinal accessory nerve, and that's intact. That's with the shoulder shrugging and the moving the head against some resistance. And then we're going to do thyroid. Come around here. You swallow for me. Okay, and his thyroid did rise when he swallows. I didn't feel any obvious goiter or nodules or anything of that nature, and no deviations from his trachea. I think I already said that. So then we're going to move on to the thorax, or respiratory assessment. So we're going to assess everything just generally. His respirations, the rate and rhythm is regular. There's no apparent distress. I don't see any, which in a normal exam I would have him undressed from the waist up at this point so I could actually visualize to make sure there was no retractions or anything of that nature. But we're just going to say that he's not in any respiratory distress. I don't see any nasal flaring, any accessory muscle use or supraclavicular retractions or anything of that nature. And then we're going to start from the back. And again, we would just assess to make sure that there is symmetry involved with his respirations. So I'm going to put my hands approximately on the 10th rib. I'm going to have you take a deep breath in and out. Okay, and that is a symmetrical expansion. And then I would just palpate the back for any pain or tenderness.
No.
So his ribs are within normal limits. There's no pain or tenderness in his back and his ribs. There's no malalignment that I can see right now, and we'll test that again later when I have him bend over to check for scoliosis. Is there any pain with this in here?
No.
Okay, so there's no CVA tenderness also. And then we're going to check for firmitus. So I'm going to have you say the words 99 as I move my hands down your back, okay?
99, 99, 99.
Good. So that was all symmetrical. I didn't hear any decreased firmitus. And then we would percuss, in a ladder pattern. Okay, and I do hear resonance throughout, which is a normal finding. And then we would auscultate. We would auscultate in those same regions in a ladder pattern. I'm going to have you just breathe normal for me. I'm going to listen. Okay, so I heard good vesicular lung sounds. I didn't hear any adventitious lung sounds, no rhonchi, wheezing, or anything of that nature. Then we're going to come around to the anterior portion of the chest, and this is basically the same thing except for it's just doing it back and front. Also, I would listen with the bell and the diaphragm to all of these lung fields, and when I listen to his heart and everything, we're listening with both sides. We're just looking for symmetry as he takes a deep breath. We're just making sure that there's no flail chest or any abnormalities. His costal angle is approximately 90 degrees, which is a normal finding. And then we would percuss, or palpate first. So palpate chest, any tenderness to your chest?
No.
All right. And then we would percuss also. All right. And that's resonance also heard throughout, which is a normal finding. And then we would auscultate, same thing. I'm going to do it quickly, but I'll do here. Okay, and good lung sounds throughout, no adventitious lung sounds heard anteriorly either. So then we would move on to breast. Again, I would have him undressed in a normal exam, but he's seated upright. We're going to have you raise your hands for me, and do them behind your back. Okay, and I would just kind of watch and make sure that nipple line rises and falls symmetrically, and then we would just assume there's no obvious drainage from the nipples, no discharge, no dimpling, or any pain, and that they are symmetrical. And then we would palpate onto your lie flat for me. I'm going to come around this side so you can see. All right, we're going to dip your arm behind your head for me. And I would start at the upper, right under the shoulder, and this is the tail of Spence, and you would start here, and then you palpate in a zigzag form toward the nipple line, and you would tell me if there's any tenderness or anything there, okay? And no tenderness here, okay? And then we feel for axillary lymph nodes as well, and those are non-palpable, so that's a normal finding. And then, put that down. We're going to move to cardiovascular, so sit back up for me, I'm sorry. Alright, so just to inspect the chest again and the skin every time that you're doing a different system to make sure that there's no skin changes. And then as he was lying at a 30-degree angle, I would also make sure there was no jugular vein distension, and I did not see that with him. I'm going to palpate. I'm going to have you breathe, just breathe normal. Okay, and I'm able to feel the point of maximum impulse, or the PMI, and that is left mid-clavicular line at approximately the 5th intercostal space. And then we're going to auscultate. And we're going to listen with both the bell and the diaphragm again. So I'm going to be listening to the apical, pulmonic, Erb's point, tricuspid, and mitral valve. So this is 2nd intercostal space, right sternal, 2nd at the left sternal, 3rd left sternal, 4th left sternal, and then the 5th mid-clavicular line on the left. And all of those sound symmetrical in each of those places. I didn't hear any adventitious heart sounds. I heard S1, S2 throughout. I didn't hear any murmurs, any rubs. I didn't hear any clicks. So that's a normal finding also. And then carotids, again, I would listen to those. I know we already checked them or palpated them earlier in the other exam, but I would also listen with both ends, and I would do both sides. I would listen to the carotid, and I'm just listening to make sure I don't hear any bruits. And I would do the temporal also, and I don't hear any bruits, so that's a normal finding as well. Okay, then we're going to go to the abdomen. So lay down for me again. Right here. All right, I'm going to need you to pull up your shirt a little bit so you can see what's going on. Okay, so upon visual assessment, everything looks normal. I don't see any scars, any bruises or lesions that would indicate a prior abdominal surgery. His umbilicus is midline. I don't see any hernias. He is flat and contour. Again, looking for those retractions. His respirations appear to be normal. And so I am going to auscultate first with the abdomen before you touch and move around anything inside there. And I would listen in all 4 quadrants. And I definitely hear vowel sounds. All right. So those are within normal limits in all 4 quadrants. Next, we're going to move on to percussion. And I would also listen for the renal and the iliac and femoral arteries as well to make sure I don't hear any bruits or feel any thrills. And while I have him laying flat, it's another good opportunity to feel that PMI to make sure that you feel and you don't feel any like heaves or thrills at that area. And then you can also measure the aorta from right here. And so starting with percussion first, I would percuss down until I no longer heard dullness in the right upper quadrant. And then when I start hearing tympany, you would measure that border, and that would be the border of his liver, which should be between 6 and 12 centimeters. And then also you would hear dullness to the left upper quadrant for his spleen too. But I'll percuss. And those are all, I hear tympany throughout, so that's a normal finding. And then we're going to look at soft palpation we're going to do next. So I'm going to palpate a little bit, tell me if you feel any pain with any of this movements. There. Okay. So that was a normal finding. I didn't feel any abnormal underlying organs or anything. We're going to do deep palpation now though to ensure that I don't feel any kidneys or anything like that. Okay.
No.
And I would also check for rebound tenderness in the right lower quadrant to make sure his appendix was not painful. And I don't feel any underlying organs. I don't feel, I'm not able to palpate his liver or his spleen, so those are normal findings. And then, one more thing. I didn't do abdominal reflexes. So his stomach should draw up, and it does. I do that. So let's just check in reflexes after that. So then, and that's another good time too to check inguinal lymph nodes, and we would expect those to be non-palpable, non-tender, and discrete. And also his femoral pulses bilaterally, we would expect those to be +2 in brisk. And then we would move on to musculoskeletal for the extremities. So I would palpate all extremities. We would do this on both sides. Again, skin is warm and dry. We're going to check your, we already did his neck range of motion. We said that was +5 and full range of motion in the earlier assessment. So we're going to do shoulders next. Raise your arms up behind your back. Okay. Hold your arms up, sorry. Raise up, down. Okay, full range of motion and +5 in his shoulders. And then we'll move on to, we already did your neck, shoulders. Let's do your elbows. Arms out, arms up, back out, twist. Okay, hold them back up. And then do it against resistance. Okay, +5 and full range of motion also. Have you lay down one more time. We're going to do knees. Have you in here so long. It's okay. Okay, move your knee up to your chest. And out. Okay, raise it. Okay, good. And pull down. Good. And then we'll check feet. Put your feet back, forward, in, out. All right, you can pull against and push down like a pedal. Good. So +5, strength and full range of motion in the legs and the knees. And we're going to check your hips and pelvis. And again, I would do this bilaterally. Have your knee up. Bend it for me. All right, and we're going to push it that way. Bend it in and out. Do it against resistance. Good. So his hips and pelvis are also +5 and full range of motion. And then we would check all the pulses. And I already checked temporal and carotid. I would check brachioradialis, radial pulse. Again, femoral pulse, it will be normal. His popliteal, posterior tibial, and dorsalis pedis. Sorry, it took me a second. And then we would move on to reflexes. Stay put. Let me grab my reflex hammer. Move back around to this side. Okay, so we're going to do bicep first. Normal. Okay, and then we're going to do brachial, or brachioradialis. That's normal. Okay, sit up for me on the side of the bed. And we're going to do tricep. Just have it, just relax it down. Let me hold up all your strength. Okay. Okay, and that's normal. And then we would do patellar. Okay, there we go. And then Achilles. And that's normal. So I would do that bilaterally. So those are all +2 and normal reflexes. And then while I've got you here, we'll do Babinski. Hold your foot out for me. Babinski reflex. I'm going to have you do this. And his toes did not fan out, so that's normal finding as well for the Babinski. That's negative. So lastly, we're just going to go back over a few things that we didn't already touch in the HEE&T section for the neurovascular section. Sorry, not neurovascular, nervous system. So in neuro, again, he's conscious, alert. He has been talking to me through the exam. His speech is clear, it's coherent, he was oriented to person, place, time, and situation. There's no cognitive impairment. He's followed all my commands appropriately. Can you tell me the 3 words that I told you in the beginning?
Apple, Mickey Mouse, tree.
Okay, good. So his recent memory is intact. Can you tell me where you graduated high school?
Out of high school.
Okay, so his remote history, his remote memory is also within normal limits, which is a normal finding. Then we're going to do some stereogenesis, and this is when I'm going to place a object in your hand that's a very common object. I just need you to tell me what it is, okay? Close your eyes.
Okay.
Okay, so stereogenesis is intact and normal. And then graphesthesia, I'm going to have you close your eyes and hold your hand out. I'm going to write something in your hand, a common number or letter, and tell me what it is.
Yes.
Okay, so that was normal also. And then again, sensation, I would do the sharp and dull. We're going to do that one more time. We're going to do it the same thing I did to your face. We're going to do that to your arm and leg, okay? Close your eyes.
Dull, sharp, sharp, dull.
Good, and I'm going to do that to both sides. And then checking motor function, he walked in with a steady gait, so that's his motor function or cerebellar function is good. Also checking fine motor function. Can you do like this with your fingers? Okay, his fine motor function is intact. Also touch your nose and touch my finger. Okay, touch your nose and then touch my finger. Do it as fast as you can. Good. So rapid movements are accurate and they're intact. So stand up for me. Let's start over here so they can see us on the camera. Maybe. We're going to do, you can stand in front of me. We're going to walk that way. Do heel to toe. Okay, good. And then turn around. And then walk on your tippy toes back to me. Okay, and then walk on your heels that way. I'm sorry, I'm making me dizzy. Okay, good. And then come stand right back over here so we can camera again. And that's just checking motor function and cerebellar function, and his balance is good. His gait is steady. He doesn't appear to be swaying or anything. And then just stand still with your arms down by your side and close your eyes. Okay, and that's Romberg test, and that's negative. And then hop up and down for me. Okay, so that's just one more thing to check motor function, and that's intact. So that completes the head-to-toe assessment. Thank you for your time.